Hi, I'm Dr. Avril Roy. I'm an American board certified internal medicine and critical care physician, and welcome to today's episode of The Inquisitive Intensivist. Most of us think vaccines are just for kids, but do you know that even adults have diseases that can be saved with vaccines, and skipping them can leave you vulnerable to serious and potentially life threatening infections? So, why does adult vaccination matter? Our immune system from childhood vaccines can fade over time. Plus, as we age and develop health conditions, we become more vulnerable to infections such as pneumonia, shingles, which is chickenpox reactivation, or influenza. But these vaccines not only protect you, they also protect your family and coworkers by doing something called herd immunity, where because you're vaccinated, the disease can't spread through you. So, what are the vaccines that we can use in adults? So, the common vaccines are influenza or the flu shot. We give this every year. It reduces the likelihood of severe influenza and prevents hospitalizations, especially for older adults or adults who have comorbid conditions such as asthma, diabetes, lung diseases such as COPD. We can use Tdap or what's called the tetanus, diphtheria, and pertussis booster once about every 10 years. This is because the immunity from childhood starts to fade about uh, once we hit like 30, 40. Also, the tetanus vaccine only works for about 10 years. Then there's something called shingles, which is meant for adults over the age of 50 or any adult over the age of 15 with immunosuppression. And this is for patients where it prevents shingles, which is a reactivation of chickenpox. It prevents long term nerve damage and, in some cases, even brain infection and seizures. And of course, we have the pneumococcal vaccine, which is meant to prevent bacterial pneumonia for adults above the age of 65 or those who have chronic health conditions. It prevents pneumonia, it prevents infections of the blood, and of course, meningitis, which is an infection of the brain. Some optional vaccines for patients or people depending on their lifestyle and where they travel: hepatitis A, hepatitis B, uh, human papilloma virus up to the age of 45 is usually indicated for most women as now even men. Typhoid vaccines if you live in a high risk area, or yellow fever if you plan to travel to Africa. So, how do you get vaccinated? Check with your doctor or your local clinic. You need to show them your previous health history along with previous vaccinations so that they can recommend what is due and when it is due. Vaccines are usually easily available at most hospitals and pharmacies. And staying updated on your vaccine is one of the most easy thing we can do to prevent serious illnesses. This is Dr. Avril Roy with the Inquisitive Intensivist. If this helped you, please hit the subscribe button for more science-based health tips in 3 minutes or less. Stay curious, stay protected, and we'll see you in the next episode.